See you back in a bit. We want to turn our attention now to a really serious problem that is just affecting too many families. Teen suicide rates are climbing at an alarming rate in this country. In fact, the CDC says they jumped up by 70% from 2006 to 2016.
Tadevik spoke to teenagers today to hear directly from them about what is behind these numbers. And Tadevik, you say they're just not surprised by these statistics.
Yeah, you know, I was really shocked to hear that they were not surprised by these numbers. In our state, here in Washington, experts say every week 2 kids commit suicide. It's the #1 cause of death among kids between the ages of 10 and 16.
I'm taking 7 classes with Nordic.
High school student Megan Munson is in class 8 hours a day, holds a job, and plays sports.
We're trying to figure out who we are and what we want, but at the same time we're being pulled in so many different directions by so many different people who we still care about, and it's a lot of pressure.
She says a lot of factors can drive a teenager to feel suicidal, but these days social media plays a big role in heightening the pressure to be perfect.
It's definitely a pretty negative feeling if you go through your Instagram feed and everyone looks like they're having a great week when you're having a terrible one.
Munson says social media also serves as a platform to vent, but it's hard to tell what's going on behind the screen.
We don't know if it is just a joke or if they're really going through something important.
Dr. Alex Hamling says he's seeing more teen patients come in talking about the kinds of pressures Munson is feeling. He says parents should directly ask children about suicide.
Just because you ask your child, you know, do you ever consider harming yourself, or do you think that you'd ever commit suicide, won't plant that idea into their head, won't drive them to want to harm themselves or commit suicide. The only thing it will do is open up those doors of communication.
Munson says adults checking in can help, but for teens to open up, they need to feel like their feelings are valid.
I think it could help if parents checked in, so long as opening that dialogue wasn't like, oh, if something's negative, there will be consequences.
Munson says she's found ways to cope with the pressures, but that's come with a sacrifice she felt she had to make to be healthy, like making sure she sleeps 7 hours a night instead of staying up to do homework.
I don't think it's fair that I had to sacrifice like a 4.0 in order to just have basic human functions like feeling stable and feeling happy or healthy. And I think that just is very telling of the workload we have and how unfair and unreasonable it is.
Dr. Hamling says if teens are posting things on social media about wanting to hurt themselves, sharing strange goodbyes, or giving away some of their favorite items, those are hidden signs for parents to look for. He also says if teens are cutting themselves or showing more violent signs like that, those are cries for help that should not be ignored.
I want to ask you about that social media piece, because so often that is where the cry for help goes out. Did the doctor say what parents can do concerning that?
Yeah, you know, he says that parents should absolutely monitor children's social media. He says it's just too risky for kids to have that much access online. Parents should friend them, look at what they're doing. You know, don't run the risk of them hiding these kind of very dangerous behaviors online.
Yeah, don't feel bad asking for your child's device.
Absolutely.
All right, thanks, Tadevik.
Well, the FBI is in the process